Welcome to Industry Focus, the show that dives into a different sector of the stock market every day. Today is Wednesday, February the 6th, and we're talking healthcare. I'm your host, Shannon Jones, and I'm joined via Skype by healthcare guru Todd Campbell. Todd, how are you?
I'm great. I'm excited. This is going to be a fun show. Really just love diving into these companies that nobody's ever heard of.
Yes. So for our listeners, today's show is all about under-the-radar healthcare stocks. Some of them you may have heard, others likely have never crossed your path. So we've got 4 stocks, 2 from Todd, 2 from me that I think our listeners will appreciate. Todd, let's just dive right in. Let's start with you. Your first stock is actually a genetics player known as Invitae, and that's ticker symbol NVTA. Todd, what is it about this stock that just makes it so compelling for you right now?
Well, what I wanted to do, and I usually do this every 6 months or so, Shannon. I'll go into one of my screening tools and I'll say, show me the stocks that are beating the market by a significant amount over the course of the last, 6 to 12 months, that are also putting up just remarkable revenue growth. And I do that with a market caps of, say, less than $5 billion, because I want to try and find some up-and-comers maybe that the large institutional investors haven't really spent the time and attention yet in getting to know about, and thus, might end up driving demand later on. 2 that I'm going to talk about today, the first one here being Invitae. I have been desperately trying to find a stock that I wanted to invest in this space since Foundation got bought out by Roche. And this is the one. I mean, I do have it in my portfolio for full disclosure. It's got a market cap of $992 million. And their goal is to bring genetic screening to the masses, if you will. They want to, be able to be a one-stop shop where you can get genetically screened for any information that you might want to know. And they want to be able to do it at a very low cost, which I think is key to breaking down the barrier and making this something that everybody can go out and get, because I really do believe that that's where medicine is going. We're going to personalize medicine. We're going to know our genetic makeup and our predispositions, and what drugs may or may not work well for us based on that. That's my personal opinion. And Invitae already has products on the market, and they're growing very, very quickly, Shannon.
Yeah, significant growth. Then I want to go back to something you mentioned, because I don't think investors holistically really appreciate just how fast the technology has moved when it comes to genetic testing and just mapping the human genome. 20 years ago, just reading one human genome took literally years and cost more than $1 billion. And today, you're talking about maybe a few hours of your workday, and we're getting closer and closer to that $100 mark in terms of mapping human DNA. So the economics are coming together. The opportunity is huge. And to see a company like this, not named Illumina, is certainly encouraging. But yes, I think the growth runway for these companies is huge.
Yeah, they want to have comprehensive. They want to do it cheaply. Just to give some listeners some numbers here. In 2015, they were able to bill for 19,000 genetic tests. In 2016, we went from 19,000 to 57,000 billable tests. In 2017, we went from 57,000 billable tests to 145,000 billable tests. Through the 9 months that have been reported in 2018, that number then jumps to 206,000. And in January, they said the full year was 302,000, which is double the prior year. So just remarkable demand growth. And I think a lot of that is because, the prices are falling. Like I think that they say now about 28% of their business comes from individuals or institutions, and the remainder comes from third parties like insurers. So they're getting more broadly reimbursed. The prices are coming down. That's allowing people to go out and get it on their own through their doctor. And of course, sales are jumping as a result. In 2019, Shannon, they think they're going to do $220 million in sales. That's up from the preliminary $144 million last year and $68 million in 2017. So in the span of 3 years, going from $68 million in sales to $220 million in sales.
And if you back that out even further, if you look out over the just past 5 years, 5 years ago, they were only making $1.6 million in revenue. So it makes that 220 million mark even more astounding just in terms of how quickly they've been able to grow sales. But Todd, it's really not just about growing the top line, because they've also been able to really cut down on expenses too.
Yeah, I think this is a scale business. You know, as you get more and more scale, you're going to be able to increase the profitability. Their gross margins are a little bit lower than others that are already out there, like Myriad Genetics is one of their competitors. The gross margins are a little lower. And as they get the scale, that the profitability should improve. And right now they're still losing money, right? Because they're investing in growing their business. That does not concern me, because it's such a fast-growing business, and I think that it's a disruptive business, and I think the market opportunity is so big that I'm willing to suffer through some losses for that. One of the other things that attracted me to this company, Shannon, was the fact that this is a spinoff from Genomic Health. And it got spun off in about 2012. And its co-founder and executive chairman is Randy Scott. Randy Scott, prior to founding Invitae, Randy was the co-founder of Genomic Health. He was also the founder of a company called Insight. Now, listeners may not be aware of it. Genomic Health has become one of the largest players in genetics. Their market cap is about $3 billion. Insight has become a massive drug developer. Their market cap is about $17 billion. So, you know, I kind of like these been there, done that kind of leaders. And, you know, with Randy Scott having been there and done that, that gives me a little additional confidence. He owns about 6.5% of Invitae's shares.
So there's a lot to like about this company. I also like, too, that they're not just focused on the consumer side, but also, too, just partnering with biopharmaceutical companies as well. They've got a partnership with Disruptive Therapeutics, a company we've talked about a lot on the show. And so they actually announced they were expanding that partnership. I believe it was in May or June of last year. So you can see how they can grow the consumer side and also grow with the biopharmaceutical side as well. So a lot to like. Let's talk about your second stock, Todd. This is one. The name of the stock is Inspire Medical Systems. Ticker symbol is INSP. And they've got an innovative approach to a condition that really impacts so many millions of people, and that is sleep apnea. Todd, what is it about this company that really sticks out to you as being so innovative?
I'm one of those millions. I mean, you know, I actually was diagnosed with mild to moderate sleep apnea earlier in the year, and you know, I'm trying to find a solution that works well for me, and that's why one of the reasons that I was so intrigued by Inspire Medical. It's a little bit bigger market cap. It's 1.25 billion market cap, but it's also incredibly fast growing. And the reason that they're fast growing is because a lot of people like me are struggling to find a good solution for sleep apnea. What Inspire Medical did is they developed a minimally invasive device that will deliver a small stimulation to a nerve by monitoring your breathing while you're sleeping. And what happens with that is that your tongue will sort of move forward a little bit so that you won't block your airway, causing that apnea. So this is a really, really interesting idea because it's very different than the other approaches that are commonly looked at. I mean, you have these devices like mouth guards that you can wear that may or may not work. They didn't work for me. You have CPAP machines, which are those things you wear on your head like you're, I don't know, in some sort of science fiction movie that blows air into your airway to keep your airway open. That's also used. And then, of course, there's surgical options, but those can be pretty costly, and you know, the outcomes are uncertain. So this is a really interesting idea because it fits in between, okay, CPAP doesn't work for me, but I don't necessarily want to go out and get surgery. And so far, sales are starting to ramp up, you know, pretty quickly as more and more insurers agree to reimburse for it.
And Todd, it's not just sleep apnea that this potential implant could help, but also snoring as well.
Yeah. They talk about the complications that are associated with sleep apnea and snoring: higher blood pressure, hypertension, heart failure, stroke. I'll add divorce. If you can find something that will keep your partner happy,
that's right.
That's
Todd.
always a good thing, right? It's a pretty large market. You said 17 million people in the United States with moderate to severe obstructive sleep apnea, and about 2 million per year are prescribed CPAPs. And according to Inspire's data crunchers, about 35% or more don't comply with daily use of those CPAP machines. So potentially a very, very large market for the company that it's only now just beginning to penetrate. Its sales in the third quarter were 13 million, which sounds small, but that was up 80% year over year. And, not only do they have the opportunity to continue to penetrate here in the U.S., but they've also started to sell this in Europe. And the sales in Europe rose 141% year over year last quarter. So for the full year 2018, their guidance was 47.5 million, gross margin of 81%, and a loss. They're losing about 4 or 5 million per quarter right now. But again, I'm not so worried about those losses because big addressable market opportunity, fast revenue growth, and relatively disruptive product.
Yeah, disruptive in more ways than one. I have to admit, as I was studying for the show last night, I was actually in bed, and I pulled up the website, and I noticed that they had actually taught a remote control that you can actually turn the device on and off. And as a mother, my first thought was, oh my gosh, if my 8-year-old daughter somehow got a hold of this device and went wild, what would happen in that case, Todd? Do you know?
I think, honestly, what it is that you just, when you go to sleep, you hold the remote over where the implant is to activate it, and then you set it aside, and then in the morning you shut it off. So just make sure you put it in a drawer.
Put it in a drawer. But yeah, I do love the fact that this is an innovative product, no mask, no hose needed, and really just the convenience. I know it is battery operated, so you will have to replace the battery after 11 years or so. But just like you mentioned, Todd, this is a great in between not having to go through surgery, not having to worry about a CPAP, but something that is minimally invasive and could potentially bring relief to hundreds of millions of patients around the globe. So with that, let's shift gears. I want to talk about two stocks that are on my radar right now. The first of which is a company called Allogene Therapeutics. Its ticker symbol is ALLO. Todd, one of the first things that I like to look at when it comes to investing in biopharmaceutical stocks, especially early stage companies, is management. I think management is really one of the most vital components. So I'd like to see an experienced management team, people that have been able to bring drugs across the finish line. They've jumped through the hoops. They know how to interact with the regulators, and Allogene is no exception to that. Allogene, the management team, is probably best known as the executives behind Kite Pharma. And Todd, you and I have talked a lot about CAR T therapy and Kite Pharma, but to see Ari Beldegram and David Chang as the faces behind this new company that just IPO'd in October, I have to say I was thrilled and excited, and I cannot wait to see what happens with this stock.
Yeah, Beldegram, he isn't just known for Kite either. I mean, he sold a company called Genesis to Astellas for over $500 million back in 2007. He founded a company called Cougar Biotech that developed Zytiga that he sold to Johnson & Johnson for $1 billion in 2011. This is a person who has done some pretty interesting things. So I'd be really curious to see if he can catch lightning in a bottle yet again. It was funny, when I was looking at the stock, I realized UCART19. I saw that, and I was like, wait a minute, UCART19, is that their drug, or is that Pfizer's drug? Whose drug is that?
You are absolutely right. UCART19 is a part of the deal they picked up from Pfizer and then the French-based Servier company as well. So yes, UCART19 coming back to life here. And so one of the things that I really, really like about this company is, so we've talked about CAR T therapy, which is basically where you're taking a patient's own immune cells, their T cells, taking them out of the body, re-engineering them in a lab, growing them, and then giving them back to a cancer patient to fight cancer. So you've got these supercharged T cells. And so we've seen Novartis has a CAR T. Kite, of course, has a CAR T now under the umbrella of Gilead Sciences. And so obviously you can think about the logistics that are involved with going through this process. Sometimes the wait time for patients is 3 to 4 weeks from vein to vein. So there's a lot of opportunity for these next generation CAR T therapies to hopefully not only cut down on the time, but also the cost. And that's really where Allogene is focused. It's something called allogeneic CAR T, where basically it's the same premise, but you're getting a healthy donor to donate their T cells, which hopefully by that point are in much better shape than, say, a cancer patient who may have gone through chemotherapy. So you've got a healthier T cell that you can now give to a patient and potentially fight cancer. So I love the approach. I will say it's a little strange for me, Todd, just knowing that, Arie Belldegrun sold the company Kite Pharma to Gilead Sciences for $12 billion. Obviously, I could only imagine what that pitch was like in the room. But as soon as they sold it, now you've got this new company with this allogeneic approach that they are easily saying is going to be the CAR T therapy moving forward. So a little interesting strategic move on their part there. But I do love the science. I love the management. It's still very early on. Their lead asset that we talked about, UCART19, that they picked up is in phase 1 development. So it'll be a while before we really start to see what the allogeneic approach can do. Again, there's pluses and minuses for both types of CAR T therapies, side effects that you do have to watch. But this could be a way for them to actually gain traction in terms of logistics and also reimbursement.
Yeah, I think greater than 10% of the people who are waiting for their own CAR Ts to be re-engineered and shipped back to be used in them actually either pass away or because of manufacturing delays or whatever, never actually end up getting that CAR T medication. So there's a huge need for something that can be delivered off the shelf. And I think that could be very disruptive. You mentioned the Gilead Sciences connection. What's interesting as I was going through the SEC filings is I noticed that Gilead actually owns 8.4% of this company. So that's something to keep in mind, too. Maybe Gilead that was kind of the negotiation there. Why don't you take a little stake here? And then, if it goes off well, who knows? Maybe you might want to acquire us as well as like you did with Kite. Pfizer owns 25% of the company because of the deal to get their hands on UCART19. And then Belldegrun owns about 14% of it.
Yeah, and so the stock IPO'd I mentioned in October 2018 raised over $324 million, basically valuing the company at that time at over $2 billion. Stock is up about 24% since its debut on the markets. Right now, sitting at about $31 a share, with the market cap of about $3.7 billion. And so, yeah, this will be a company to watch moving forward. Again, very early on, but definitely put it on your watch list. So that brings me to my second stock, our final stock pick, and that is a company that is known as Myovant Sciences, and that's ticker symbol MYOV. So I like stocks that obviously have good management, have innovative science behind them. But I also really like stocks that just have a good news cycle coming up. And really, Myovant Sciences, when you look at their pipeline, they could potentially have 5 phase 3 data readouts in 2019. And it really comes down to their drug, which is their bread and butter, and it's called Relugolix. And I'm not going to say that any faster than that because we'll get tongue-tied. But Relugolix is the drug behind the company. And so really, for Myovant, they are looking at 3 indications, primarily focused in women's health, but they also have one in men's health. But in the women's health side, they're looking at uterine fibroids and endometriosis, and on the men's health side, advanced prostate cancer. So the drug itself is known as a GnRH antagonist therapy, which in short is being studied for its ability to suppress hormones that regulate the menstrual cycle. The idea is if you can regulate the hormones, you can improve many of the painful and just debilitating symptoms that happen with uterine fibroids and endometriosis. So in 2019, they've got phase 3 Liberty 1 and Liberty 2 data reading out potentially as soon as the second quarter of this year, and also again in the third quarter. In the uterine fibroid space for phase 3 Liberty 1 and 2, that's an indication where over 3 million women suffer in the U.S. and 250,000 actually have to undergo hysterectomies because of uterine fibroids, which are basically these benign tumors. So that indication in and of itself is huge. What I really like about this indication is that also this is not necessarily a new space. There are other companies out there that are developing products for it. But in Japan, Myovant is actually partnered with Takeda, and Takeda actually had positive phase 3 data in this indication. So obviously the read-through here on the U.S. side definitely beefed up its chances of approvability. We'll have to wait and see on that, but uterine fibroids is the one to watch first for this particular company.
Could be a big battle between this company and AbbVie down the road, because AbbVie has elagolix that actually just got launched in one of those two indications last year, and expected sales about $200 million there. They do think that their option is going to be better than elagolix, though. It requires once daily dosing instead of twice daily dosing. It has a longer half-life, so they think they can compete more effectively. They picked up the drug. This is a Roivant company. So, people who follow the industry, this is Vivek Ramaswamy's, one of his companies. Roivant is kind of like a biotech incubator type of company. They go out, they buy do these licensing deals to take drugs that have already been under some development by other companies. In this case, it was Takeda that developed it. Roivant went out and acquired the rights to it, and then Takeda and Roivant went out and started up this company. Roivant owns 61% of Myovant. Takeda owns 12% of it. And interestingly enough, as I was digging through the SEC filings, Pfizer appears to have a right of first negotiation on licensing U.S. rights to the drug if it's successful. And those rights also may apply to a deal. So kind of an interesting kind of side note for that as people look forward to the data readouts and start contemplating, okay, well, what's Myovant's exit strategy? Is it going to try and commercialize these things on its own, or might it try and find a partner, or might it just be up for an open acquisition?
Absolutely. And you'll also need to be watching the endometriosis space. Todd, you mentioned that in regards to competitors, that's where AbbVie's Orlissa got approval last year and has really been dominating the space. I think I see a commercial for that drug at least once a day. So they've got very strong commercial presence out there. So it'll be something to watch. But Myovant will have data reading out with this sometime in 2019. And then I mentioned also the men's health program in advanced prostate cancer. Really for men, and using this drug, decreasing testosterone is thought to slow the growth and also the progression of advanced prostate cancer. So it kind of makes sense that they're going after that. The company does say that they're the only GnRH antagonist receptor in development for prostate cancer as well. Much smaller.
That's interesting. That's interesting. Just want to jump in because I don't forget, because it makes sense now with the Pfizer deal.
Yes.
Because Pfizer bought Medivation to get its hands on Xtandi, which is a prostate cancer drug. Sorry.
And the connection goes even beyond there. The CEO, Lynn Seeley, of Myovant, was actually formerly at Medivation, which got bought out by Pfizer. So you see, okay. It's all a connected network here. But all in all, across all of those indications, you're looking at, right now, analysts are estimating about $2.5 billion in peak sales. When I looked, market cap was right around $1.3 billion. So it certainly makes a compelling buying opportunity right now, I think, especially with these improved odds of getting across the approval finish line. So the stock is sitting right now at $18 a share, up about 12% year to date. So lots to watch here, a lot to like. But all in all, I think, Todd, you and I have given our listeners 4 very compelling watch list stocks.
I think they're all going to be very busy looking at digging into these names over the course of the next weekend.
Absolutely. Well, we'll be sure to keep you updated. As always, thanks so much for tuning in. That's it for this week's Industry Focus Healthcare Show. As always, people on the program may have interest in the stocks they talk about, and the Motley Fool may have formal recommendations for or against, so don't buy or sell stocks based solely on what you hear. This show is produced by Dan Boyd. For Todd Campbell, I'm Shannon Jones. Thanks for listening, and Fool on.